ahead and get started with the slideshow. And so this is titled, as Nicole mentioned, it really is a journal club, and it's also a little bit of a brief didactic by myself. So staying current with best practices in supporting your patients, the latest literature on integrated care. And I just wanted to start with a brief overview, sort of the main points of what we hope to cover, or what I'm going to cover and what Nicole's going to cover. The first part is going to be just kind of a refresher. I know this is the third time, probably in about a year, that we've done this, where we've, the first time we really tried to explain fully what we're doing, how we're gathering this information. I'm just going to quickly go through that today, and we'll probably start to cycle it out in the future. The next portion will just sort of be a brief didactic, kind of within a didactic. It's going to be talking about sort of a topic we haven't really talked about within the context of these journal clubs, like thinking about this research, being applicable to you all as care providers. We've talked about that quite a bit, but we haven't really talked so much about when that meets the patients. So if the patients want access to reliable healthcare information, what does that look like? Some of it might seem obvious, some of it might not be quite so obvious, but I just want to go over that because whether it's because of COVID or because of what people have mentioned within ECHO over the past, 12 months or so, it seems to be a recurring topic. And then Nicole is going to end things up with a deep dive on one of the publications from the list. So, okay, so the refresher part is just thinking about this is the journal list. Want to make sure that you guys are all aware of it. I can share a link to this list. I know that Jamie's going to be sending it out soon. And so there will be a list arriving to you all, which provides what's pictured here. So we start by pulling every single couple of months. It's really what Julaine helps with, pulling from a variety of different sources. And we do this, of course, to inform clinical practice and promote lifelong learning. It's probably the main aim of this. We also, as I'm going to address today, potentially, hope to inform patients and caregivers and parents by exposing them to the latest research or just medical information that's been translated from the research. Not to get too jargony, but, get away from just thinking of everything in terms of what the algorithm produces, because sometimes that can lead to the same publications being cycled through, and there could be problems with those publications. And for any researchers on the call, I mean, hopefully a list of research articles will be beneficial to you. So I'm just going to quickly go through this in case anybody's interested in where we gathered these results from. It's from a variety of different databases listed there at the top. And then shout out to Julaine, who's just started with this project. She's the person who goes through each month, cleans it up, and then puts it into a database, which you'll see linked to from the citation list. And it's all around access and just keeping all this information in a single place. So we have, I believe, over 2,500 publications that extend back several decades on integrated healthcare for treating severe mental health problems. So we will go over that in future, and you'll see that within the citation list, but we did just want to highlight that. And also it's worth mentioning that these items are quality controlled by Nicole and myself and Julaine and Jamie. So this is just the final point about the current list. I mean, you will see, like, for example, this is what Nicole and I considered in addition to the one that she's going to highlight later in this session. So there's a lot of great content within there, and just want to sort of promote this for later to not overlook and just think about the one we're going to talk about right now. And again, these will come out on a bi-monthly basis. So now I'm going to pivot towards that topic I introduced at the top of this session, which is thinking about probably something I hope all of you guys have encountered, which is whether it's consumer health information or actual research articles, patients, caregivers, parents wanting to know where they should get information, how they should understand the information they find, especially because, as I'm sure we're all aware, information is very easy to come across, and misinformation is very easy to come across too in today's world. So within this short section, I will go over consumer health information, which I will clarify what I mean by that. And then I do like to qualify this, when appropriate, encouraging patients and parents and caregivers to refer to peer-reviewed and other forms of scholarly literature. And I will say, as sort of a context piece, a lot of this is informed by my own past working with a pediatric palliative research network, where you would have, rare conditions, neurological conditions and other conditions. You'd have maybe 5 patients spread across, this was in Canada, who have it. And so the parents and care providers are really interested in finding the latest literature on these conditions because it isn't widely known. They're still being explored oftentimes. And we would often hear when we would tweet out as a research network about specific publications, the latest research literature, we would often see from non-researchers and scientists who would openly declare that on their Twitter feed saying, how can we get access to this? And so what dovetails with that is thinking about how the content's going to be restricted or not restricted. So open access or non-open access. So, but first, let's just think about consumer health information. So, generally speaking, I refer to consumer health information as basically a synthesis at a standard reading level that's going to, any adult really should hopefully be able to comprehend consumer health information. Depending on, the privilege and the background of that individual within our society. But there are highly reputable sources, 2 of which I recommend listed at the top, Mayo Clinic and Medline Plus. And Medline Plus was pictured on the previous screen, Mayo Clinic pictured on this screen, which provides very expensive information to create for patients to be able to understand conditions, before their and after their visits. And I know that I'm probably preaching to the choir here, but in a way that is hopefully unbiased. So getting away from the random websites that we all encounter. And at the end of this session, I'd be curious if this would be a broader discussion about this being an issue that you see on a regular basis, because I know, especially I list COVID-19 there, that has sort of put this into sharp relief, just like a lot of other health problems in our society, inequities in our society. People's access and ability to discern between high quality, reputable information, health information versus information that's provided for potentially ulterior motives, whether it's profit or just ignorance on behalf of the people providing the information. I think that it is a very big obstacle. And so I will delve into a little bit of what the library's been doing lately and how that can hopefully help. I think it's worth mentioning whenever talking about consumer health information, especially, well, within any sort of rural or urban setting, thinking about the barriers to access as everything moves online. Hopefully you guys are aware of this, that, not everybody has internet, right? And so it creates these huge barriers to being able to get access to the content. So I know that paper printout content is often still seen as a great way to disseminate the information over online when you're talking about communities who might not have internet at home. And then I've already talked about the other 2 topics. So I did want to also highlight this because working for Neomed Library and also working with our director, Terry Robinson, who has a background in public health and health disparities, we've been interested in supporting the local counties, especially considering that Neomed was created for that. So Portage County in particular, through a Stark Community Foundation grant that we received, to start gathering the sorts of consumer health information, in this case, handouts, but also advocating for Medline or Mayo Clinic, and then starting to work with local community groups to get that to the populations who need it the most. So we're still in the process of working on this, but we've been partnering with public libraries, of course, because that's where a lot of people go to access things online when they don't have internet access at home. And we've also heard from the local librarians throughout Portage County that they do get questions about medical topics and they don't know how to respond to that. So an easy answer for us was to work with SOAR because it is serving the same demographics that we're trying to help. And they were very generous to provide a collection of consumer health handouts that they had vetted internally and they use on a regular basis with their patients. And so going forward throughout this year, specifically within Portage County, we hope to get this content out to those community grants, whether it's showing the librarians and the Portage County Health Department, people who have ideas about how to disseminate this content, just showing them the website, which I have pictured here, or starting to print out content and doing flyers within these community centers to advocate for, we're not the experts, and so we've worked with SOAR in this case. And this information, kind of in a similar way to, for those of you who saw Jen Dougal's presentation on clinical guidelines, a lot of this information floats in very disparate pockets of the World Wide Web. There's no, at least none that I've seen, a centralized database for consumer health handouts, let alone one that's very targeted towards regional needs. And so this is our attempt to help provide that information and make it publicly available online and present the, like this one here is made by the CDC. So because it's made by the federal government, we can present it in a way that is not violating copyright. I will share the link to this website in the chat once I'm done. It's still a work in progress, but it is free to access this section on relevant consumer health handouts. So going back now to the content in the list and what Nicole's going to talk about in just a few minutes, is really thinking about the other side of this. When you have patients or caregivers or parents even who want to access and understand peer-reviewed literature, or the research literature that's usually published just for the academics, but I encourage citizens who feel confident reviewing this content to always do so. I'm thinking within patient-centered care objectives, et cetera. So I always say this can be seen as an opportunity. And I already mentioned my story about, like, especially like Best Center or like the Pediatric Palliative Care Research Network I worked for, tweeting out about articles. If there are concerned patients who fit within that specific topic area, they're probably going to see the publications that are being pushed out, and they might not be able to access it, or they might be able to access it if it's open access. And so just in terms of access, it's always worth mentioning that people can go to any publicly funded university in the state of Ohio and get access to all the expensive research literature. This would especially apply to you if you're working for a clinical practice that is not attached to something like Neomed or a major health network, because these resources are expensive. The other thing to keep in mind is a lot of the time, or not, hopefully it's a lot of the time, but sometimes it's not as often as you would hope. The publications are made available in open access form, which just generally means that it gets away from what you see at the top of the screen here, which is a paywall. So people don't have to pay money to access the research. This one specifically is available through what we provide here to Neomed patrons. It's called just an unpaywall plugin that we've put into our publication finder feature. You can always contact me if you have trouble accessing an article and want to find out whether or not you could get it freely available. And so with that, I'm now going to hand it off to Nicole for her to talk about this specific one from the list.
Thanks, Simon. And we will talk a little bit more about the list and how that's going to go out. Jamie and I have been in the process of trying to put together what will be kind of a bi-monthly newsletter and embedding that list within that newsletter. We're having technology issues with MailChimp at the moment, so it's on a little bit of a delay, but we will get it figured out. But the article that we picked for today was it. So the Hope Health and Wellness, or HHW Clinic, is an integrated health home in Aurora, Colorado. Now they looked at this. They took this organization was one of the SAMHSA PBHCI. Let's see if I can remember what PBHCI stands for. Primary Behavioral Health Care Integration. SAMHSA, that's maybe 8 7 or 8 years ago, could be a little bit longer than that at this point, started pushing out those grants to increase integrated care within community mental health centers, as opposed to the traditional integrated care that had been seen prior to that of bringing mental health into primary care. They wanted to bring primary care into mental health. So this was one of those grantees, and they were able to form partnerships between the local community mental health center and the local federally qualified health center to do that integration within the community mental health center clinic. So they put the clinic within the adult intensive services section, I assume, of the building. Having read through the article and not seeing necessarily schematics, I assume that's what they mean by putting it in with the adult intensive services teams. And the goal was to provide integrated primary care to adult clients of the mental health center with severe mental illness. Now, the goal of this, as we know, everyone here, the idea is we're trying to reduce the health disparities that are seen within mental health populations. Next slide. So when they did this, they wanted to do some program evaluation to see if this integration was actually working to address what their goals were. But to give you a sense of what the program was and what they were offering is this new Hope Health and Wellness team consisted of a behavioral health provider. So they mentioned a clinical psychologist, but this could have been a licensed counselor, a licensed social worker, or a psychologist, but somebody to help create individualized wellness plans with the patients and to lead wellness groups. They also had a care coordinator, which in my experience would have probably been, I would be more familiar with the term case manager or CPST as Ohio uses it, but this is the person who was helping provide support with transportation, helping navigate the healthcare system, accessing different social supports. They also had a referral coordinator. So this is the person who is making sure that the records of both the FQHC and the Community Mental Health Center were talking and they were able to share information and to get new patients registered into the system. They had a peer support specialist. So, a person who is able to provide, that direct wellness for wellness and connection for as a peer or even lead some peer groups. And they had a primary care provider and medical assistant. Now, all of these folks also worked really in close coordination with the mental health care team, so the psychiatrist, and if there was an individual therapist or case manager involved also. And a nice thing about this particular place is that they had a fitness center located within this clinic and within the community mental health center, and it included access to a personal trainer for free for monthly consultations. Next slide. So their objectives that we're looking at to see if providing this type of integration would work and what it would work for was to improve access to coordinated high quality specialty and primary care. There was a number of physical health metrics that they were looking at. So BMI, HbA1c, cholesterol, triglycerides, blood pressure, and waist circumference measurements. They also were looking at some mental health and functional outcomes. So social connectedness, everyday functioning, psychological distress, perceived health, alcohol, and tobacco use. And then they also wanted to know about patient satisfaction. And within the patient satisfaction, they were asking about, was the level of staff support adequate? Did they feel like the staff was culturally aware and culturally sensitive? Did they receive an adequate amount of information about their illness and medication? And how much did they generally like the service? And would they refer a family or friends? Next one. I realized that I didn't change. I was duplicating slides as I made these, and it should say results. So we're going to cover what they found in a 4-year span. So in terms of access to high quality care, they found that the people with the highest needs, so those that tended to be the most physically ill, tended to stay in care for longer periods of time. It was really easy for those who dropped out of the integrated primary care to re-engage, so long as they had stayed engaged with the mental health services, even after several years. And in order to keep the access up and make sure that everybody is able to either engage or re-engage, the staff did a lot of outreach and continued to change clinic offerings to meet the needs of the population over time. In terms of improved health status, which is really, I think, the things that SAMHSA is looking for and things that we assumed would come out of better integrated care. At the beginning of this, a third of the people who enrolled were in a risk category on each indicator at baseline, and 3/4 of them were in risk categories for BMI, HDL cholesterol, and blood pressure. So what they found is that those that were in that high risk category for the 3 indicators, they showed statistically significant improvements across all 3 for those that were at risk at baseline. And for the entire group, they saw an improvement in perceived health, total cholesterol, LDL cholesterol, over time for the entire group of enrollees. Next slide. On the mental health side, everybody in the group saw statistically significant improvement over time in their everyday functioning, their self-reported perceived health, in psychological distress, and social connectedness. And those who had been in a risk category for tobacco or alcohol showed improvement in both of those categories. In terms of patient satisfaction, at 6 months, almost 90% of the clients indicated a positive perception of care, and that did not drop over time. They measured it first time at 6 months and then in 6-month intervals, and it stayed consistent. Next one. So the big conclusion is kind of a dry article, but I think it's important because the conclusions are what we would hope that they would be. But there is, proven benefit of bringing primary care into community mental health centers, that there is benefit in partnering between community mental health and FQHCs in order to do that. Some places have gone towards the model of being not only the community mental health center, but also a federally qualified health center and trying to be all things to all people. And that's great if you can be that, but that's not going to be a feasible model for lots of places. So having a partnership between organizations in the community is a model that definitely works. This was able to demonstrate that there's benefit of having ample opportunities for members of both teams or all teams to engage with patients and build relationships. The benefit of putting primary care into community mental health is that people with severe mental illness often have relationships with that mental health team. They're comfortable with them. That's where they get most of their care. That's where they got most consistent care and are treated well. So when you bring primary care in there, it might take some time to build those relationships, but they're doing so in a safe space for them. It's an effective way to manage chronic illness, but the key to managing chronic illness is consistency across the medical visits and medication management, particularly when you have patients that are dealing with lots of other social determinants of health and competing demands. And one of their big takeaways was that sharing the electronic record was critical. If you're going to do this well, you need to be able to share your record across the organization for the most complex patients. And Simon, I think, yeah.
All right.